The city councillors closed our block for us so that we could set up chairs in the street, and we had 7 medical student volunteers as well as a whole bunch of community volunteers who helped us to immunize the first day 220 people. The second time we did it, the Ottawa Footy Sevens, which is our local soccer team, gave us their soccer field, and that day we immunized 330 people, none of whom were my patients, but all of whom were essential workers and people who were struggling to get access to the vaccine.
By any metric, Jabapalooza's 1 and 2 were huge successes. With nothing more than a team of volunteers and a few boxes of AstraZeneca vaccine, Dr. Nili Kaplan-Myrth was able to vaccinate 825 people, many of them essential workers. But the Ottawa doc has had to cancel Jabapalooza Part 3 because Ontario's bizarre vaccine allocation plan means that as a family doctor, she can't get her hands on enough supply.
Now what I'm hearing from my patients is as soon as the province opened up for 18 and over, everybody struggled to get an appointment, and public health announced, early in the day yesterday, our vaccine clinics are full.
Kaplan-Myrth says she's frustrated because finding vaccines in Ottawa was already tricky. Many clinics are booked full while others are in remote suburbs or outside the city proper.
Well, that's really difficult for my patients who live in poverty or just don't own cars or, would have felt much more comfortable coming to their family doctor.
Kaplan-Myrth says even as a health worker, she had to fight to find her second shot, searching for over a month before eventually driving 300 kilometers away.
Does Ontario just not like family medicine? And what is that about? Why would you not want to involve primary care in what is our most major health emergency, of the century?
The first 2 Jabapaloozas used excess doses from Ottawa Public Health, but Kaplan-Myrth says the province needs to give more doses to family doctors directly. The head of Ottawa Public Health says they're just working with what the province hands out.
The province decides how much vaccine will go to pharmacies. For example, the province has made dedicated allocations to primary care channels, dedicated allocations for First Nations and urban Indigenous populations, and then what comes to local public health units.
Now, as for Kaplan-Myrth, she says she plans on running at least 3 more Jabapalooza events as soon as she can get the supply sorted out. But she's now thinking about the patients she's already vaccinated because with no timeline for delivery, she's not sure when she's going to be able to give them their boosters. In Ottawa, Xiaoli Li, City News.